Hi, everybody. Isn't Medicare fun? And now we get to talk about fraud, which is like the little cherry on top. But before we get into the fraud stuff, I think a lot of us probably encounter a lot of our lower income individuals in our county. And I'm going to go through some of the programs that are available to them, plus the financial guidelines for those programs. Plus the second packet of information you have are the actual applications for the programs we're going to talk about. So we'll pull those out as we go along. All right, the first couple here on this slide are all variations of Medicaid. The very first one is full MA or community Medicaid. It's all referencing the same thing. It is also the lowest income guideline. A lot of our individuals, when you ask them, what are you involved in? They'll say, I have Medicaid. Well, it could be any of these first four things here. So the easiest thing to do as a caseworker is ask them what color card they have. So in this case, the full MA is going to be a red and white card. That is sort of I'm going to use the word supplemental, but it sort of helps cover everything that Medicaid or Medicare does not. The next version is this QMB and this what we call Slim B. The same application will help you apply for both of these programs, actually all three of these. And you can see the different income guidelines, if it's a widow or if it's a couple, and different ways they go down there. So if you pull out that second packet, the application for the full MA is a 14-page packet. This also helps you apply for food stamps, side note. But it is the one that says DHR in the upper left-hand corner. This is yours to have a copy or to make copies to hand out to your individuals. It goes through a lot. You guys can look at that on your own. It does require signatures in 3 places, which I'll point out. The first one is on the very first page, is in the middle. The second signature is all the way towards the back, the second to last page, where you see about 6 boxes lined up. The beneficiary will sign the top line. And then the third signature is the very last page in the middle. So that is for full Medicaid. The second program, which is QMB, or Qualified Medicare Beneficiary, is a separate application. On the top it says the State of Maryland Department of Human Resources. And again, you can use this to apply for all of the other Medicaid things listed here. Now QMB does have a card. It will be a gray and white card, so that's very helpful. The other two do not. All you see is if they are enrolled in those programs is that it'll be reflected on their Social Security statement where they're not paying a beneficiary. I'm sorry.
You can ask them if they're paying us.
Right, yeah, and another simple way, as Kirsten pointed out, is you can just ask them, are you paying anything for your Medicare Part B? If they say no, then they're enrolled in something here. So anyway, so the second application for QMB, Slim B, and the Q1 is this application here.
You can't spend down and get to the QMB, right?
Not for the QMB. That would be for the full Medicaid, which that's a rabbit hole we're not going to jump down today. But I do, if somebody does ask about the spend down, I do advise you to call the Department of Social Services because they would be evaluating that.
So it doesn't have anything to do with medical bills or anything?
To become eligible for full Medicaid, there is a sort of a spend down. I'm sorry. Sorry. Okay, so that's the things that can help you either have a sort of a backup to Medicare or help you save some money in paying for Medicare. The bottom 2 items here, the state program, which is our State of Maryland Senior Prescription Assistance, or Medicare's own program called Extra Help. Extra Help is sort of the golden ticket. If somebody is eligible for that, I advise go for that. You can only apply for that on the Social Security website. That is only an online application, which is why it's not in your packet. It's an easy application, but just be advised if you have somebody that is not computer savvy, you may need to assist them with that. The state prescription help is the other application that is in your packet. The difference between the two is Extra Help will help with co-pays. It will help with your premium. It normally nullifies your deductible and just helps all around. The state program only pays toward your premium. It will pay up to $40 to the monthly premium. If you hit, if somebody hits what's called the donut hole or the coverage gap, it can also assist with that, but it's only in those two specific areas where extra help helps all around. I'm sorry, was there a question?
So, when it says two persons, if the client is living with their adult child, but their income is separate, you're still looking at the one person. Two people is just if they're married?
Correct, yes,
Okay.
excellent question. So if you have a senior who is living with their adult children, you are not going to count the children's income. It is going to act as a one-person eligibility. If the individual is married, or however you're looking at that, but if they're married, then you would be looking at the two-person income. Excellent question. So that's pretty much for the programs that help here. Yes, Jan?
And also, in a household of two adults that are partners, but they're not married, you're still being separate.
Okay, so yeah, as Jan said, they don't necessarily have to be married, but if it's an income where if the individual's incomes are helping each other, then you count both.
No.
But I'm sorry.
Now, for QMB and Slim, you're not going to count the other person. They have to be married to count as two. If there are two separate individuals, unmarried, living in the household, then it's individual.
Okay, so two unmarried individuals in the household, it is counted separate. Okay, so that was just an overview of the programs. Moving on to actual Medicare fraud. A lot of things in terms of Medicare fraud is just simply knowing what to look for. There are a lot of things out there that try to trick our seniors. I believe veterans and the senior demographic are some of the most targeted for different types of fraud and scams. A couple things that have hit our own community here recently is some of the assisted livings and senior-specific housing where a young person will come up and say, hey, I'm here to visit grandma. And somebody who doesn't know that person holds the door open for them. And they walk right in and start going door to door asking for social security numbers, representing like they're from Medicare or some other agency like Medicare, and get a lot of private information and do some bad things with that. So just some things to look for. As Kirsten voiced earlier, if you just put Medicare into Google, you're going to get a lot of stuff, and most of it isn't going to be directly from Medicare. So things to look for. The first couple things you're going to see are going to have this little green box here that say ad. That means someone paid to put their name right there. That does not mean Medicare sponsored them. It does not mean they're a valid thing that Medicare is endorsing. So look for that thing that says ad. Another thing to look for is government. If it's .com, .net, .org, it may not be a legitimate company. It might be a legitimate company trying to sell you something, but either way, it's not directly from Medicare. Another thing here is you see here that there's a particular company listed. Again, they paid to be the third thing you see there. If you remember earlier on, Kirsten referenced that there's a catalog from the Maryland Insurance Administration that talks about all the supplemental plans and those optional plans. This is that catalog from last year. There are 95 pages in this, and that particular company has one page. So there's a lot of things you're missing out on if you just look at what's coming up first on an internet search. So big thing here, Medicare.gov. Look for the gov, make sure it's a legitimate site before you get into something that's not really related to Medicare. So obviously a lot of our seniors, they're watching a lot of TV, they have their phones, and this is a lot of how the guys that are trying to get bad information or just trying to sell something are getting to them. So we have an example here, and you guys have probably all seen different versions of this, where this commercial comes on and it's like Medicare, and there's trumpet fanfare, and there's a flag waving in the back, and an eagle swoops in, and you're like, America! And it has nothing to do with Medicare. It is someone trying to sell you something. So to get to that example, you have two examples here, and about 30 seconds each.
Beneficiaries. Many people with Medicare may be able to get extra benefits and don't even know they're available. You may be able to get dental, vision, hearing, and prescription drug coverage included in your plan. Call them to see if you can get the extra benefits you deserve. The Medicare Coverage Helpline is now accepting calls. You may be able to get extra benefits, including dental, vision, and prescription drug coverage.
Hi, I'm Dr. Jason Buffalo. Making sure you go to the doctor and taking all your medications as prescribed can help protect your health. To make it easier, you may now be able to enroll in a Medicare Advantage plan that includes coverage for dental, vision, and prescription drugs. Help protect protect your health by choosing the right plan for you and get all the benefits you deserve.
Call to see if you may be able to get extra benefits, including dental, vision, and prescription coverage. Don't miss the annual election period deadline for Medicare Advantage. Call now. Call 800-714-5663.
Blah, 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 blah. So,
Not a real doctor, he just plays one.
if you look closely, it says paid spokesman. I was like, I've never seen him at Upper Chesapeake or Hartford Memorial. So, but you see how it looks legit. God bless you. So it looks legit. It looks like it's giving good information. All this commercial is doing is advertising those optional, I'm sorry, not optional, the Advantage plans. And they're saying that they're going to connect you to the right thing. And they use words and things and services that trigger our seniors' attention, like dental, hearing, those types of things. That's automatic in many, many plans. So they're just trying to sell a product here. The other version, sorry, got a sensitive mouse here. This is actually from Medicare. Some of you may recognize this. Now notice the big point I want to make here is that one thing is trying to sell you something, the other one is trying to inform you about something. So notice the difference.
I found a better deal on prescriptions. We found lower copays.
And a free wellness visit. New plan, same doctor. I'm happy.
Is Medicare open enrollment? Have you compared plans yet?
It's easy at Medicare.gov.
Or you can call 1-800-MEDICARE.
Medicare open enrollment. You'll never know unless you go.
I did it. You can too.
I love the guy at the end with the medicines. But you see the difference there, plus quality of video too. So, but again, just the big thing, ask yourself or have your clients ask themselves, are they selling something or informing you about something? So sort of wrapping up here, but if you get nothing else out of this fraud section, it's these 3 points right here. I want you to circle and star them. These are the things that Medicare puts in place that companies are allowed to do to market to our people. The first thing is the beneficiary must give written, not verbal, written permission to be contacted. I know I've been working in this field for about 1.5 years. I don't know of one client that has ever written to a company and said, please call me relentlessly. And that leads to another point, that they're not allowed to cold call you. If you are not actively receiving a service from a company, you can't get cold calls from other companies. So if you ever get somebody who's saying, yeah, I got called from this number and I don't know, tell them to hang up because they are not allowed to do that under Medicare standards. I'll go to one second. Yeah.
So, on a written permission to be contacted, does that include, like, you know how sometimes companies will send like a postcard and say, send this back to us if you want information? So is that giving them written permission to contact them?
Jan just asks excellent question. Some of these companies will send cards out that you basically just have to sign and return. I would figure if your signature is on it, then you have just given your consent. So you may want to advise your people about being mindful about whether or not they do that. So the first thing is you have to give that written permission. Another thing is they can contact you if you are currently receiving a service or they have done something to help you within recent time frame, not from 5 or 10 years ago, more within the last 1.5 years. So if you had a company that helped you get a wheelchair or helped with just whatever service, if they have already helped you is the key point there, then they can contact you. Outside of that, they're not allowed to go door to door. They're not allowed to just call you out of nowhere. If you get somebody that reports that, you guys see the little pamphlets, the little Post-it notes we put in front of you? We've been giving subliminal messages since we started this whole series of trainings. That is SMP, Senior Medicare Patrol. And if you get somebody that reports that to you, you need to let them know. This page, I'm not going to read all this. I just wanted to give an overview. This is from the SMP website, just giving an overview of what type of fraud is going on out there. If you go to that link that's cited at the top, these are all actually different links, and it'll show you more examples of those things. I wanted to point out primarily in the first column where it says consumer scams and medical identity theft. This is the only thing directly that is targeting our seniors. All this other stuff is agencies scamming Medicare. all of it. So we just have this one little piece here that we're trying to be proactive on and educate our individuals about what to look for. So overall, as of last year, Medicare loses $60 billion thanks to everything that was listed on that previous slide. About 250,000 of beneficiaries have had their identity compromised through either being stolen or something being mishandled. But, and some of you may have heard this already, in April of next year, Medicare is getting away from using your Social Security number as your claim ID, and they're going to be reissuing new numbers. We're anticipating that to come out April of next year. Sort of wrapping up here. Seeing the Medicare Patrol, their whole mantra is prevent, detect, and report. So as caseworkers, as nurses, as people that are having frontline contact with people that are being exposed to these things, our job is to educate and empower. So tell them what scams are looking like. Like I was saying, if no one's allowed to cold call you. So if something like that happens, hang up. If someone goes door to door, which has happened in our community, tell them not to give out their personal information and report it immediately. The third bullet here under remember the 3 rules, that's just summarizing that previous slide of what I said was really important to take home today. Another piece to be sort of proactive to catch some of those other things where agencies might be scamming Medicare is encourage your beneficiaries to review their explanation of benefits. Make sure that everything that is listed on there is a service they actually received. One example, as I heard recently, is a woman was sent for an MRI of 2 different regions of her body, and it was done through one scan. And the scanning facility charged Medicare twice for 2 different MRIs. So things like that. So really pay attention to those details. There's also different government agencies involved that SMP works with. That includes the Office of the Inspector General and Centers for Medicare and Medicaid Services. I have contact information on that all on page 42 towards the end here. Not going through the whole glossary, there were some things we referenced throughout our presentation today that are summarized here. Big thing that I get probably the most questions on is what's the difference between the copay and the deductible. Sorry, I'm moving out of fraud into just some general information, but copay is what you're paying at the time of service, so at the pharmacy, at the doctor, at face-to-face with your person. Deductible is just an amount that you have to pay before your plan fully kicks in. And there are different things that can apply to that, including your premium, your copays, and those sorts of things. Yeah, okay. So moving through that. These are just, like I said, other agencies. Medicare.gov is sort of your bottom line for everything officially Medicare. Department of Social Services can help with and process the application for all the Medicaid programs. Beyond that, you guys can look through and see the other programs we've already discussed. And this is just our contact at the Office on Aging. Thank you for joining us today.
Can you turn the volume up so I have from Memorial in case I have any questions? Just right here, right here. I don't know if it reaches. Hello again, everybody. Well, thank you for sitting through all that information. I know it's a lot. In Harford County, we have over 43,000 beneficiaries that need to be looking at this stuff in that 6-week or so period that's coming up, and it's so critically important for them to really take time to go through this process because we have so many seniors that are financially struggling, and the difference that a new plan can make for them in terms of their cost could be phenomenal. I sat down with an 83-year-old man about a year and a half, 2 years ago when we had open enrollment, and he and his wife didn't have a lot of income. They also amazingly didn't have a lot of prescriptions, and he was just sort of sticking with what he had because it never occurred to him. He never really paid attention to the fact that he could change this plan, and when he walked out of the office, he basically ended up saving over $1,600 a year by changing plans, and he, God love him, offered to pick my kids up from school. My kids didn't need a ride home from school though, so it was all good. And so it can really make a big difference for families that are struggling. So if you encounter somebody, as over the next several weeks, think about just encouraging them to really look at this because it can make a difference in their household finances that could be really significant for them. And 1-800-MEDICARE is always, always a good resource. So if you're not sure and you want to check or you want to refer the beneficiary to call them, they're very, very helpful, and it is a great resource. Two other things I want to mention quickly. On October the 5th, after we planned our workshop, our state office decided that they wanted to do a regional training, which they had done in years past. I think some of you were at last year's regional training. It will be held on October the 5th at the Emergency Operations Center, and it will be pretty much an all-day, like an 8:30 to 3 or 9 to 2:30, somewhere in there. We don't have all of the specific information, but they will go into more detail on specialized topics. Like last year, they had a really great presentation on SPDAP. And one of the things we didn't get into is that there's a relatively new program with the SPDAP program, the State Prescription Drug Assistance Program, where at the end of the year, individuals who are receiving that benefit can apply to get a refund if their expenses were over a certain amount. So they will go into more detail on those kinds of things. When we get the particulars of that information, we'll shoot it out to everybody who's on our mailing list and who attended today. The other thing I want to mention to you is that we're also doing community presentations for beneficiaries. We don't have the capacity to do one-on-one visits with everybody that needs assistance, and there are a lot of people we found that were sort of relying upon us who had the wherewithal and the ability to navigate their Medicare enrollment themselves. They were just sort of relying on us. And so we're really trying to promote that self-sufficiency, and there will be community sessions that are free and open to the public. The dates are as follows: September 25th, October, and that will be at the McFall Center from 6:30 to 7:30. These are all 6:30 to 7:30. The next one is Tuesday, October 3rd at the Ronnie Chenoweth Center in Fallston. And then the last one we have scheduled is the 9th, which is at Howard E. Gray Senior Activity Center. And they're all 6:30 to 7:30. October 9th, yes. So it's September 25th at McFall, October 3rd at Chenoweth, and October 9th at Howard E. Grace. And they are free, but we do require advanced registration. So we will also send that link out to everybody probably tomorrow if you want to share that with individuals. We have limited seating capacity, and we just sent the flyers out last week, and registrations are rolling in very quickly. So if you have beneficiaries you want to refer to those sessions, we're happy to have them join us. So I want to thank our presenters. They did a phenomenal job. Great job. Thank you. Any last questions from Hartford Memorial? You guys good? All right. Okay, you're good. And I want to thank all of you. There's a lot of information. I know it's hard to do at the end of the day, in the middle of the week, but there are so many people to reach, and having you guys be able to share this information and having you here today means a lot in terms of really helping those beneficiaries get the services and the resources they need. So we thank you as well. Everybody take care. Our next session is October 25th. Yes? And I know this when I come up here, but it goes out of my head. And that will be the first presentation of the community partners going over the services and programs that are offered by their agency, and it will be the Hartford County Office on Aging talking about our programs and services and resources and eligibility criteria. So we look forward to seeing all of you again then. Take care, everyone. Be safe.